Host modulation, the concept. Consider these the epithelium, connective tissue, and this the alveolar bone. With accumulation of subgingival plaque, the bacteria cross the junctional epithelium and enters the connective tissue. Bacterial products and toxins also enter the connective tissue. This initiates an inflammatory response. In response to bacteria, the resident polymorphonuclear cells migrate to the site of infection and phagocytose the bacteria. This will normally contain the invasion. If not able to contain, the epithelium, connective tissue, and PMNs produce inflammatory mediators. These mediators signal the blood vessels and causes vasodilatation. Thus, more PMNs, monocytes, and macrophages are recruited to the area of infection. Once the bacterial products enter the circulation, the lymphocytes start emerging from blood vessels and enter the connective tissue. The leukocytes together produce various chemical mediators to neutralize the bacterial products and kill the bacteria. Thus, the inflammatory reactions limit the infection. Once the inflammation has limited the infection, in disease-resistant individuals, host cells like PMNs, lymphocytes, etc. produce various anti-inflammatory mediators like TIMPs, interleukin-10, 12, and interferons, which will resolve the inflammation and restore the state of normal tissues. In disease-susceptible individuals, the inflammation does not resolve. Rather, more inflammatory cells are recruited to the site of infection. They become hyperactive due to bacterial triggers and produce more inflammatory mediators like MMPs, interleukin-1, 6, PGE2, and TNF-alpha. These inflammatory mediators destroy the collagen, resulting in connective tissue destruction. Still, if the inflammation is not resolved, it extends to the underlying bone. They produce pro-inflammatory mediators and signal the osteoclasts. They activate and recruit the osteoclasts to the surface of the bone. The activated osteoclasts destroy the bone. Gradually, the bone loss increases. This connective tissue destruction together with bone destruction result in periodontitis. This is the diagrammatic representation of the concept. The microorganisms and their antigens like LPS induce an host inflammatory response. If not contained, the host immune system acts uncontrollably, producing cytokines, prostanoids, and MMPs, which results in connective tissue breakdown that manifests as the clinical sign of disease. For periodontitis to develop, it needs bacteria, the microbial challenge. This initiates the disease. The microbial challenge elicits a host response. When uncontrolled, this host response is responsible for the progression of the disease. Conventional treatment approaches like scaling, root planing, and use of antibiotics control only the bacterial component of the disease. What about the host component? This is taken care of by the concept of host modulation. What is host modulation? Host is the organism from which the parasite obtains its nourishment, and modulation is the alteration of function or status or something in response to a stimulus. So, host modulation is a treatment concept which aims to reduce the tissue destruction and stabilize or regenerate the periodontium by modifying or downregulating the destructive aspects of host response and or upregulating the protective or regenerative responses. Thank you.